we have this patient for whom we are going to be treating the trigeminal neuralgia with botulinum toxin injection. So as we all know that botulinum toxin is basically a medication which can be used to relax certain muscles like the forehead lines, the frown lines, and it can be used for atrophying the masseter muscle. But not many people know that botulinum toxin can also be used for trigeminal neuralgia. So in this case, the maxillary nerve, the branch of maxillary nerve, the infraorbital nerve has been affected, and she's having pain into the infraorbital nerve. So trigeminal neuralgia is a condition wherein when we touch last part of one nerve, like for example the infraorbital nerve or the mental nerve, the patient has severe pain, lancinating pain, which can be so stabbing and so painful that patient normally complains, and the patient complains of severe pain. That can happen while chewing also, and while moving also, moving the lips and even touching the surface area. Now this normally happens because of a compression of the nerve at certain central level by some blood vessels. Now in this condition, the second branch, the infraorbital branch of the maxillary nerve, which is a branch of trigeminal nerve, has been affected. And so when the patient touches this area especially, so if you see here, this is basically where the infraorbital nerve comes out from the skull. So there's a foramen called the infraorbital foramen from where the nerve comes out. So when we touch this area, she has severe pain, or when she moves, she has severe pain. She has actually taken carbamazepine for almost like 10 years. Now the carbamazepine has stopped working. Now what we are planning to be doing in the next couple of months is we are going to be doing a neurectomy for her. But in the meantime, we thought we will be trying with botulinum toxin injection because she wanted a non-invasive procedure. So if you see here, this is where my infraorbital nerve is. So this is where it comes out of the skull. So the infraorbital nerve, and basically it supplies the lateral part of the nose, the upper lip and the lower part of the eyelid. So what I am going to be doing here is I am going to be injecting into this into the skin. So how does it botulinum toxin work in trigeminal neuralgia? So I am going to be injecting here a botulinum toxin called CX, okay, from Meditox. So I'm going to be injecting here into this area. So basically what botulinum toxin does when we inject into the skin here is basically it helps to reduce the production of the neurotransmitter substance P. So the substance P actually has got a very high inflammatory action onto the skin level. So it suppresses the production of the neurotransmitter substance P, and that is how it is going to help. The second thing what it also does is it also suppresses the release of CGRP, the calcitonin gene related peptide, which is an inflammatory neuropeptide again, which is released, and because of that the patient has severe pain when we touch that area. So all these nociceptive mediators are going to be suppressed with botulinum toxin, be it substance P or the CGRP. Now most important thing is we are going to be injecting at the dermal plane only. So we don't want to go deeper into the muscles, because our job is not to relax the muscles here, but we are going to be suppressing the substance P and the CGRP, which are actually the nociceptive receptors, which are going to be, you know, kind of activating the nociceptive receptors, which are basically the pain carrying receptors. So what I'm going to be doing here is I'm going to be injecting into these areas. Now this is where the infraorbital nerve comes out. So what I have planned here is going to be injecting about 2 units. So I have made boxes of 1 centimeter here. So this is the area where the main infraorbital nerve comes out, and also I'm going to be injecting into the other boxes, which is going to help me in reducing this the production of the nociceptive mediators like the CGRP and the substance P. So I have already cleaned up this area. Now if you see, I have taken about 14 units. Now what I'm going to be doing, I'll be starting from here. So all I am doing is I'm going into the dermal plane, and I am going to be injecting about, if you see here, I'm injecting about 2 units. Again I am going to be injecting about 2 units into this area, about 2 units. So I'll be, as I said, the botulinum toxin would diffuse by 1 centimeter. So I will be injecting into this areas. So she is very comfortable here. So I'm going to be covering up the entire area that could possibly be supplied by the infraorbital nerve. Yeah, and finally I have given and infiltrated into everything. So final infiltration I will be giving into the area which is the main supply of the infraorbital nerve here. If you see, I have injected in all this 1, 2, 3, 4, 5, 6, 9 boxes. So this is going to be diffusing by a centimeter all around. Everything is going to diffuse by a centimeter. So that means that the entire area is going to be, the entire dermis is going to be hit by the botulinum toxin. So it is going to suppress the production of the nociceptive receptors here, and that is how it is going to. So the effect is going to be lasting for about 3 months, 3.5 months. And so normally we ask the patients to come back and repeat the injection in 3.5 months if the patient works, if the botulinum toxin works. But finally we have to think of a neurectomy procedure wherein we are going to be kind of taking out the whole infraorbital nerve here. So that's going to help us in a permanent relief of the pain here. So that is how we treat botulinum toxin. We treat trigeminal neuralgia with botulinum toxin. Yeah.